This is the Emergency Medical Minute.
So something we don't see very often, so let's give you a little clinical scenario. Brought in by family, elderly gentleman, actually not that elderly, 50s, late 50s, but looks 70s. Gentleman has a lot of chronic illnesses and basically comes in, brought in by family, saying he's just not acting right. They think he's kind of slurring his speech. He doesn't really seem with it. It's been a fairly rapidly progressive decline over the past couple of weeks, all very vague things. Maybe a little bit jaundice, they feel, which is a new finding for him. So his presentation vitals are actually okay, normal vital signs, other than we can't get a temperature on him. So I don't know if anyone was here for this guy, but just can't get a temp, and so tried all these things. Feels warm to the touch, but just can't get a reliable temperature. Finally, get a rectal temp that is again kind of difficult to get it because it took so long to get it. So one said like 87, one said like 92. So definitely seems to be truly hypothermic, but core is warm. Extremities are kind of cool and poorly perfused in general, and he is diffusely swollen. Anyone want to take a guess at what?
Swollen?
Diffusely swollen. Okay, Anna got it. Myxedema. So what's myxedema? Anna.
You go.
What's that?
I want to steal your thunder.
Oh, yeah, there you go.
Profound hypothyroidism.
Profound hypothyroidism. So profound hypothyroidism mixed with some stressor that pushes you into myxedema. So true myxedema coma means that you have coma. You're altered profoundly. But this guy kind of just had slow mentation, some dysarthria. Part of the reason he has dysarthria is his tongue gets swollen, sort of in the same process that myxedema develops. And technically, myxedema is non-pitting edema. So his ultimate problems kind of come to light that his TSH is 160, so normal is like up to 5. His so just a couple of things just for management. So basically, obviously, these patients are critically ill. Mortality is 30 to 50%. Obviously, it's a rare condition. You have to sort of suspect it. And I think really the thing that, anytime you have someone profoundly and persistently hypothermic without an environmental exposure, you really have to think about the hypothyroidism. Treatments, ICU admission, pressure support, and really their blood pressure and hypothermia resolve with thyroid hormone administration, but you have to be careful. You can throw them into atrial dysrhythmias, ventricular dysrhythmias, acute cardiac decompensation. So you have to also manage their glucocorticoids to make sure that they're having stress dose steroids to manage any adrenal insufficiency that's ongoing with it as well.
Emergency Medical Minute is and always will be about free medical education. Medicine's most prolific podcast is successful because of our supporters, donors, and of course, our listeners. Please like us on Facebook and follow us on Twitter. And if you support spreading free medical education, please donate at our website, emergencymedicalminute.com. As always, keep listening.